Good day and welcome to Toshiba. Around the world, providers of computed tomography are being challenged to improve dose effectiveness and clinical efficiency. Aquilion 1, with its robust, non-helical cardiac scan procedures, helps you to make your diagnosis for every patient at the lowest possible dose. In single or multiple beat helical cardiac scanning, in general, the scannable population is limited to patients with low and stable heart rates. Aquilion 1 is the only CT scanner overcoming these traditional limitations. With the Aquilion 1, you can scan every patient independent of heart rate and physical condition. With a coverage of up to 16 centimeters, each heart is captured without moving the patient. One rotation, one beat, one volume. This makes the Aquilion 1 the world's fastest cardiac CT scanner, and its robust performance guarantees superb imaging every time without compromise. Unique cardiac protocols on Aquilion 1 include low-dose one-rotation scanning for calcium score, coronary arteries, and plaque imaging. The one-beat cardiac protocol is used for ejection fraction, wall motion, and valve imaging. Advanced prospectively gated arrhythmia rejection for patients with irregular heart rates, and multi-segment reconstruction for patients with high heart rates. This wide range of protocols gives you the flexibility to image every patient with exquisite quality without compromise. Over the next few minutes, you will experience the new standard in cardiac scanning. Next to sub-Millisievert imaging, functional imaging, and coronary plaque quantification, we will show you Aquilion 1 unique applications like rest stress, myocardial perfusion, and scanning of patients with complex heart rhythms. Using a prospectively gated ECG scan, the coronary tree can be imaged in just one rotation. With this prospective technique, sub-Millisievert dose levels can be achieved whilst maintaining absolute uniform temporal resolution. Lowest dose combined with superb volumetric image quality. With the helical scan principle, dose-saving features for prospective scanning only work up to 65 beats per minute. This limitation does not apply to the Aquilion 1. Due to its revolutionary scan technique, dose saving is applicable in patients with heart rates of up to 180 beats per minute. Using the Aquilion 1, you can save dose for every patient. For evaluation of plaque in the coronary arteries, a software application, SurePlaque, is available. With the high-resolution images from the Aquilion 1, SurePlaque automatically provides detailed information on plaque components and structure, as well as vessel and lumen diameter. Within a vessel, lipid-rich plaques, intermediate plaques and calcified plaques are depicted and displayed using plaque-type-specific coloured overlays. Also, the percentage of plaque burden and stenosis, as well as a remodelling index, are calculated. The excellent reproducibility makes SurePlaque an extremely valuable tool for follow-up studies. Myocardial perfusion compares rest and stress studies to give an indication on myocardial viability. Also here, the prospective scan method can be used to keep dose levels as low as possible, even when the heart rate is above 65 beats per minute. One-rotation perfusion scans are automatically performed at the peak of contrast enhancement, resulting in reproducible viability studies combined with high-quality coronary imaging. The volumetric scan guarantees absolute temporal uniformity, while the short scan times preclude inner rest or inner stress myocardial perfusion fluctuations as seen in helical scanning. Differences between rest and stress perfusion patterns are not only presented as bullseye polar maps, but can also be easily depicted in colour-coded 2- and 3-dimensional images. The specific advantages of the Aquilion 1 makes this system the benchmark for myocardial perfusion and viability studies when using computed tomography. For cardiac functional analysis, just scan a single beat. As no other CT scanner covers the complete heart without moving the patient, one-beat cardiac functional analysis is unique for the Aquilion 1. Parameters such as ejection fraction, diastolic volume, systolic volume, myocardial mass and cardiac output index scan one beat and all are automatically calculated. Next to these parameters, the one-beat scan will give you superb images of the coronary arteries and artifact-free dynamic images from any viewing angle. With the ECG gated dose modulation technique, patient dose savings of up to 60% compared to conventional 64-row scanning are achieved. Making optimal use of the Aquilion 1 features, the one-beat scan can be implemented in the myocardial perfusion protocol, avoiding unnecessary additional dose. Only the Aquilion 1 combines cardiac anatomy, function and viability in one procedure. You are certainly aware of the classical limitations in cardiac CT. Low and stable heart rates are an absolute prerequisite. These limitations apply to conventional and high-pitch helical scanning, however not for the Aquilion 1. As the 16-centimeter coverage makes patient movement superfluous, an on-the-fly rejection of arrhythmia or irregular heartbeats is implemented in the Aquilion 1. This is a patient who was scanned while his heart rate fluctuated between 43 to 95 beats per minute. With the Aquilion 1, you still get artifact-free dynamic studies for wall motion evaluation and analysis of the cardiac function. The motion-free coronary arteries can be used for plaque quantification. Only with the Aquilion 1, you can scan every patient with optimum results. Use less dose. Image fast. With robust results. Quantify coronary plaque. Check cardiac function. Diagnose myocardial viability. The Aquilion 1, the scanner for every patient. Whether you'd like to discuss what Aquilion 1 can bring to you and your patients, or view cardiac studies from around Europe, our exhibit staff will be happy to help you. Thank you for your time and have a great day.